Ladies and gentlemen, welcome to this week's episode of What the Health Just Happened, where we talk about all things healthcare, the good, the bad, the ups, the downs, the lefts, the rights, and everything in between. We also bring on a variety of community leaders, advocates, nonprofits to talk about all things healthy versus unhealthy life and business. Today, I think it's a combination of the two. So we're going to do some healthcare. We're definitely going to talk about a big event coming up, but I'm going to do a little intro here for you. You ready?
Yes.
Joining us today is physical therapist, doctor in physical therapy. Is that the proper term?
Yeah, that sounds good.
Okay, with UF Health Rehabilitation, you're also representing A Night for Heroes, which we're going to talk about a lot today. You have your undergraduate from the University of Florida, your doctorate degree from the greatest college in Florida, the University of North Florida. Swoop. We got some UNF graduates in here. Proud husband, father of two, ages 5 and 7. Welcome, Dr. Edwin Rivera.
Yeah.
Was that okay?
Perfect.
Okay, we nailed it. Oh, it's the hardest part for me is these introductions. So I laugh, right? How did we end up here today emailing back and forth?
Yes.
This is the first time we've actually met in person.
Yes.
Let's talk with physical therapy. So what's the education look like? Where do you start? And at what point in your life do you think, I want to be a physical therapist?
So my story is probably a little bit different than a lot of people's because, you talk to a lot of PTs and they were athletes who got injured and they, dealt with PT and then they got inspired that way or something like that. Really, like my undergraduate degree is from UF, from the College of Journalism and Communications. So
you should be doing this for a living.
Yeah. I did a lot of like that stuff like in school. Like I was looking at more like TV, radio, and I was actually wanting to maybe even go into movies.
It's not too late.
Not too late. Well, I did some internships. I did some internships when I was in school. I interned on 2 movies, The Transporter 2. I was like a set production intern.
This is a good start already.
Yeah.
I've seen that movie, by the way.
Yeah, it's not very good.
It's not.
No. So I thought that was also a bad sign. And then there was another movie that they actually called me and asked me if I wanted to do it. It was actually in Gainesville because I was still living in Gainesville and they wanted to do one there. It was called The Hawk is Dying.
I'd never heard of it, but I'm going to watch it when I get home.
It was also equally terrible, but it actually had great actors in it. It actually had Michelle Williams, Paul Giamatti, and it had this woman named Rusty Schwimmer, which a lot of people don't know who she is, but she's more like, she's been on several different things, but she's never starred in a movie that I can think of. But it was a great experience. I was actually on the set for that one. Got to even drive and get to meet Paul Giamatti. I got to drive him to his hotel a couple times, and it was awesome. It was a great experience, but I just realized the hours insane. Like you're working like 15, 16 hours a day, 7 days a week. You're living out of a suitcase. I just realized that wasn't the life for me. Like I wanted to have a family and a wife, and a lot of those guys are divorced and
multiple times.
You're making good money, but it's not a life that I wanted. So I kind of had to rethink my life. And at the time, I was really into working out and fitness and health, and I had some friends who were getting into PT in the PT program, so I got interested. And so I actually applied for a job in Gainesville at Orthopedic and Sports Institute, which was Shands at the time, and got the job in the hand and upper extremity department. So I worked there with the hand therapist for like a year.
What were you doing? Were you like next to him helping do the rehab?
I was a tech.
You were the tech.
I was a tech, so I would bring them back. I would kind of get them started with their paperwork, ask them some subjective questions. They would let me help with wound care and stuff once in a while, like unbandage and stuff. And it was fun. My favorite part was just the one-on-one with the patients.
Yeah.
I really loved the talking with them and hanging out with them. I loved to watch the progression. It was great. I just loved the environment. And so I just realized, like, that's the thing I want to do. So I actually had to go back to school, get all the prereqs, the physics, the
biology,
chemistry, the anatomy,
physiology. I had to do all that stuff.
So I had to go
Nothing
back.
like going back to school after you graduate to get into another school.
I know. So I had to go back to school, get all that stuff done, which took a while. Then I applied to a couple schools. I got waitlisted at UNF. And
Swoop. Sorry. We say that a lot.
I got waitlisted originally, and then, didn't get in. I had to wait a whole nother year.
Were you working at the time still in the...
I was working there. I was actually working, I think I was... Actually, at that point in time, I think I was actually like a service manager at Chipotle in Gainesville for a while.
I probably ate there while you were working there.
You probably.
Yeah.
I still love Chipotle. I still think that place is great.
Free plug for Chipotle.
I know.
You guys want to sponsor the show, by the way? Feel free.
So yeah, I had to wait around for another year and finally got into school. I was like the second oldest person in my program, so it was pretty funny. Yes.
Did they make fun of you?
No.
Did you get close enough with your classmates where they're like, look at this old guy in here?
I wasn't the guy, like the oldest guy. Actually, the oldest guy, like some people thought he was a professor at first because he was like a little bit older. So, but
how long was the doctorate program?
So it's 3 years once you start.
3 years, all academics, or are you doing rotations?
So academics, and then towards like the last year, it's more internships and things like that. So at the time, UNF had 5 internships. I think now they only do like 3, but they're longer. So when I was there, they did, I think it was like 2 or 3 6-week internships, and then we had to do 2 8 weeks was the last 2. And so they expected you to be your last 2 to be pretty entry level. Like they thought, like by the time you're doing your 4th and 5th, you should be pretty close to being.
Were any of those with UF Health?
So
I'm just curious, the journey getting to UF Health, which we'll talk about.
Well, yeah. So I actually did one internship in Gainesville, at an outpatient clinic in Gainesville. I stayed with a friend of mine who was a hand therapist there, so I stayed there at an outpatient clinic there. And then, and the reason why and then the other ones were all local. But the reason why I picked UF is because I'd already had experience with them in Gainesville.
Yep.
And I loved the system there, and I loved working there. And, it was my first thought when I applied. And actually, when I applied, the only position that was open was a part-time position. So I applied to Memorial. I was working for them, too. PRN, I applied to them. And then they, when I talked to the director there, she said, well, yeah, we want to, I know it says part-time, but we're looking for full-time. Do you want to interview for the full-time?
Yeah.
Yeah, I want the full-time job. So I applied, and
this is with UF Health Rehabilitation, right?
Yeah.
So just again, UF Health is massive. So
right.
Let's just talk about Jacksonville. You have 50 different different departments, right? And we'll talk about Trauma One in a little bit, specifically Night for Heroes, obviously. So you get this full-time position with UF Health Rehabilitation. Do you specialize in upper extremities? So you've talked about hand stuff a lot. The specific person we're going to talk about was an arm injury.
Right. So really, when you're done with school, you're essentially a generalist. You know a little bit about everything, but maybe not specifically like specialized in anything. So you're going in there, open book, just trying to learn, figure out what you're interested in really. And when you're, in outpatient orthopedics, you really are seeing like a wide variety of cases. Like I don't see hands. That we have hand therapists. Most of the hand therapists that you'll see are occupational therapists, but PTs can be hand therapists too. But that's very specialized, very niche. Mostly hands and elbows and shoulders they normally focus a lot on. But for the most part, like I see like the shoulder, the knee, the hip, the ankle, a lot of back, a lot of neck issues, things like that.
What is your least favorite part of the body to work on?
Well, I'm not a big fan of hands. So
you could be a hand model though. He's got these tattoos, all of it, but your hands are looking good.
Oh, thank you, sir. So yeah, like I don't do a lot of elbows. Like we have, like I said, the OTs typically do a lot of that stuff. So if I do happen to get like an elbow, I normally will, like, hey, I could treat you, but I have specialists that can probably do a better job than me, kind of thing. My favorite probably body part is the shoulder, to be completely honest.
Yeah.
I do like the complexity of the shoulder. That's probably my favorite.
Is it more complicated, more work? We had talked about like most frequent injury, hardest to heal from. You mentioned shoulder beforehand.
It's so much more vastly complex, personally. I just think there's so many layers of muscle there. It's such a free floating joint. Like your knee is it bends and it straightens. It moves in 2 different directions.
It's not a ball and socket joint.
Right. It's a ball and socket joint. It has multiple different directions it can move. There's a big interplay between what the rotator cuff muscles, the muscles that control the scapula. There's a lot of different things going on in the shoulder that just make it more challenging and and more interesting to work.
I have many flaws, one of which is kind of taking a hard left. Do you ever see the movie Rookie of the Year?
I think years ago.
The kid hurts his shoulder and then he can throw the ball like 100 miles an hour.
Right.
Can that happen in real life?
I would say that's
Could we put a ligament in my shoulder and you rehab me so that I can throw a 100-mile-an-hour fastball?
Probably not.
So definitely not. You guys hear that? There goes my dream. I wanted to be a professional pitcher.
That would be my guess. Probably not going to happen.
So let's talk about, and again, we never know who's going to listen to this, but potential physical therapists in the future, maybe patients. What are difficult patients to work with? I think it's important for people to know this. Yeah. So if you're a patient rehabbing or you're a family member, this makes your life more difficult.
So, the patients that I feel like are the most difficult are the ones that come in not really ready for rehab. Those are the hardest ones. Like you get people that are motivated, that want to be there, that are game for anything, and then you get other ones that are there only because their doctor tells them to be there, or they're there because they want imaging and they know they have to do PT to do imaging. And so those are the ones that typically, outcomes typically aren't the best because they're not trying. Sometimes I do enjoy the challenge of trying to motivate them.
You talk about that one-on-one time early on in your career. Yep.
Yeah. So I do I try to explain to them that, we could really potentially help you. I do the evaluation. I talk to them about physical therapy and the benefits of it. But a lot of them too have already been through the system and they know, I've been to PT, this isn't going to work for me. But, maybe they had a bad experience. Maybe they didn't go to UF Health. They went somewhere else.
Who's the worst competitor? I'm kidding. You can't say that. Don't badmouth your competitors. So non-compliant, I think, is a big one. Recurring theme.
Non-compliant. There are the patients too that are very pro-surgery and they just want to have surgery.
What are your thoughts?
Well, no. So
that's the last resort for me.
Last
surgery.
resort.
You gonna try? I think Trey wants to ask a question.
Oh yeah, I got a question for you because you're talking about patients. Does the size of a patient when it comes to a shoulder, so fit person versus maybe non-fit, does that make it any more difficult on you to do your job?
It makes it more challenging in the sense not necessarily fit people that are fit and that exercise, they are more body aware. So trying to teach somebody that's more body aware and how to do things correctly is much easier. If somebody hasn't really exercised and they've never really done anything with their shoulder or done anything upper extremity, it's more challenging to try to teach somebody how to properly squeeze your shoulder blades, proper mechanics. That can be kind of hard,
Awesome.
Yeah.
Anything else you want to chime in there?
Well, I did have another question. It had to do with your tattoos and your physique. Are you a biker or a runner by chance?
So no. So I do Brazilian Jiu-Jitsu a couple times a week.
Don't mess with this guy. Immediately, as soon as he walked in, I'm like, don't mess with this guy.
Is that good for the shoulders?
Good or bad?
It's bad. But
asking for a friend.
So and then I try to weight train a couple times a week at least. Any kind of sport that you enjoy of course you're going to put yourself at risk to kind of injury. I think the big thing with a lot of the guys that I train with is that they train injured a lot. They're very competitive.
Sure.
They injure their shoulder. They don't want to stop. I've had a couple injuries. I had a pretty good neck injury where I actually lost some sensation in my fingers. I had a lot of weakness. I couldn't even lift a dumbbell to do a chest press 20 pounds. I lost quite a bit of.
Did you see a physical therapist?
Yeah, right here.
He looked in the mirror.
So I rehabbed myself. I just took some time off, and then when I went back, I didn't start sparring and grappling. I just kind of did drills with people, and you just always tell people, hey, I got this neck thing. I'm going to take it easy. And you just ease back into it.
Man, I almost want to talk about jiu-jitsu the entire episode, but we can't because I
love it, man. So
I'm
if you have any more questions.
I keep telling my wife, I'm like, look, I need something that's competitive.
That's when I started.
And she's like, you're too old for this. I think a lot of guys do. And if you I'm not going in there. I have heard, and now here we go, going off topic again. A lot of times, younger guys, again, that 18 to 24 range, male or female, they're just more competitive. And someone like me, I'm just trying to stay in shape and I wrestled a long time ago.
Yeah.
Is that accurate? That sometimes.
Well, the thing is all right. Yeah. So the younger guys. I mean, I've only been doing it for a few years. I'm just a blue belt. I started when I think I was 40, 41. So
okay, so I can do
age.
it. You hear that, Stephanie?
Yes. And I guess the thing is like at the beginning when you're a white belt, when you're starting, you don't have any technique. You don't understand how to do everything. So where I go, you have to be there for a certain amount of time. When you've earned your first 1 or 2 stripes, you can start kind of doing a little more grappling. And you'll notice you're normally grappling with other white belts. And there's no technique. It's all 2 people
get hurt.
muscling each other. Right. It's not pretty at first, and I guess that's the place where you can probably get injured. Like now I enjoy rolling with people that are higher ranked than me or my rank belt because they're a little, it's hard.
Harder, awareness goes
but
back
they're
to the
right.
PT.
They're more technical, especially black belts and brown belts. They let you work. They're not just trying to murder you. They'll take their time and they'll let you make mistakes and try. They'll help you too, and they're not trying to murder you. At least most of them. I'm sure there's some people out
just
there.
murder you.
Yeah,
we're gonna cut that clip off. You talk about murder? No, this is jiu-jitsu, by the way.
Yeah. So there are those. I actually now, as a blue belt, I actually get more nervous rolling with like white belts than anything.
That makes sense.
Because they just want to try their hardest and kill you. But they really do try their hardest to try, to essentially, they don't know what they're doing. So it's just all muscle. And so you're fighting a guy.
Yeah. I'm envisioning this and almost having nightmares. I'm like, maybe I shouldn't.
No, it's great though. Because honestly, the people there, because they're the nicest people. Where do you go? Great. Jacksonville Gracie Jiu-Jitsu.
Jacksonville Gracie Jiu-Jitsu. I like anytime we get to shout out someone local that you clearly have nothing but the best stuff to say about.
So Louise and Pedro Paul Harris, they're great. And the people there are awesome. They really will help you a lot.
Well, you got a future member here. Before we go back to UF Health, I think after this episode, we should record Trey and I wrestling each other right in the studio.
No, absolutely not. He's a wrestler. I'm not a wrestler.
Yeah.
All right. Here we go. I got to rein it back in. Just talk about UF Health, and then we're gonna really hammer Night for Heroes the second half.
Very cool.
Back to UF Health rehabilitation. Yes. Do you mind sharing your story how you met your wife? Because I think that's hysterical. And then miraculously, you got moved to another location.
Yeah. So my wife is a physical therapist too. There. So I met her there, and we kind of at first started just being friends, and then we kind of started dating, but we knew we couldn't tell anybody, so we kept it on the down low for a while. People started getting a little suspicious because we would always be hanging out, talking to each other. A group of people ran into us at a restaurant once. They're like, "What are you guys doing together?" We're like, "Oh, hell, I was helping her move, and she just took me out to breakfast." So it got harder and harder and harder. Then eventually, cat was out of the bag. We kind of just, hey, we're dating. And coincidentally, around the same time, they decided, we feel like you would, it'd be good for you to go to Emerson location.
I love it.
It really helped you because I was pretty new out of school, probably 6 months out of school. So, they pitched it as I think it'd be beneficial to have a different type of patient caseload there and it'd help you grow as a PT. So
let's talk about that. So Emerson caseload. What does a physical therapist caseload look like? What's busy? Is it 3 patients a day, 10 patients a day?
Yeah. So the great thing about where I work, about UF
Health Rehabilitation.
Yes, UF Rehab is we have one-on-one care. It's 45 minutes, one-on-one. I'm blocked off every 45 minutes. So on average, 10 patients in a day. If you go to a lot of different places, the PT
15 to 30
is
minute caps.
2 to 3 patients every hour, and it's hard. It's hard to get. Personally, I just believe it's hard to get good patient care if your PT is juggling. If they're bringing you to a corner to do exercises, and they gotta go to see somebody else, and they gotta go see somebody else. You don't know if that person in the corner is doing the exercise correctly. You don't know if they're doing something to hurt themselves. You're really not giving them the patient care they deserve. So being one-on-one and being able to sit there and watch them constantly fix their form and their position, spend plenty of time educating them, getting to know them is so much better. I feel like the outcomes are so much better.
All right, we got a couple minutes here till the commercial break. UF Rehab, we talked about that a bit, your journey getting there. So Night for Heroes, second half is going to be a lot about that. I assume we'll still talk plenty about UF Health, of course. So Night for Heroes, I wrote down some stuff. We can read about it the second half. We also, Megan Ortega, did I say that right? She's in the corner, going to hop on. Is it Ortega? Ortega. I said it wrong. I'm sorry. Edit that out. Just kidding. Leave it in there. So Night for Heroes, you have been rehabbing this year's honoree. We're going to do our best not to say his name because you requested not to say his name.
Try my hardest.
If you can, in a couple minutes, what happened to him? All right. What was the injury and how did he come to your front doorstep?
Yeah. So essentially, he is a pilot. He owned his own plane. And he was on taxiing on a runway on at the airport here. What he tells me is there was some kind of delay, and so what he wanted to do is he actually got out of his airplane to be nice. There was a plane behind him, a propeller type of airplane behind him, and so he went to go talk to that person and kind of, I guess, discuss what was going on. He just had he lapsed in judgment, focus. He didn't think about it. Turned around and walked right into the propeller.
Do you know if it was a single prop or dual prop plane?
I'm not sure.
It doesn't matter.
Yeah.
Just like for a visual, I hate to go to Indiana Jones, that movie back in the day, but this gentleman who's a pilot and probably 99.9% of the time very self-aware, walked into a propeller and his right arm was destroyed.
Destroyed, yes, 100%.
And then again, Night for Heroes, and I'll read this in the second half, it is to put a spotlight on those first responders, the people who essentially save a life. And then this year they're honoring that outpatient care that again is a huge part of helping these people recover.
Right.
Is that, again, a very brief synopsis?
Yes, exactly. So they pick one of their many saves they do in a year, and they picked him to do it for this year, and they pick honorees based on, I guess, the time you spent with him. So it was great. I think it's the first time they actually have picked outpatient ortho PTs to do it. And there's actually 4 of us. So shout out to Nisha Patel and Katie Cooper and Kelsey Hearn. All of us got nominated because we've all worked with him.
Congratulations and well-deserved.
Thank you. And yeah, so me and Nisha are still treating him at this point, and I've been working with him for about 10 months now. We're still working together.
So this specific honoree for Night for Heroes, you've been treating him for 10 months.
Yes.
We got 2 minutes of the commercial break. I just say it out loud. He hides it. I'm like, we got 2 minutes. Progress. Like, how much progress have you seen in 10 months?
Really good. Really good. He's still got a lot of stuff we got to work on. But from where he was and where he's at now, he's made a lot of progress. He has an extensive amount of soft tissue damage and scar tissue that he's constantly battling. He's like, he talks about, they literally cut muscle out of his arm. So he's missing chunks of muscle in the shoulder and the arm in general. So it's challenging because, we're working on mechanics and form and building endurance, but he's also missing some of those key
I commend you and the entire team, obviously saved a life and making progress. But I'm going to call you Dr. Edwin Rivera. He said just call me Edwin. But with UF Health Rehabilitation, we're going to talk about Night for Heroes in the second half. That's what the health just happened. Welcome back to the second half of What the Health Just Happened. If you missed the first half, good news is you can find it on one of your favorite podcast platforms. What are they? Apple, Spotify, iHeartRadio. There's too many of them now to keep track with. But first half, so we have Edwin Rivera, doctor in physical therapy with UF Health Rehab. A little bit of a conversation about Night for Heroes, which Megan Ortega, I got it wrong twice, who also works with UF Health. We're going to have you talk all about the event specifically. And again, just to recap, a lot of physical therapy stuff. We might have talked about Brazilian Jiu-Jitsu, the honoree of Night for Heroes, which I'm sure you can chime in for. But we're going to do one of my favorite segments, Healthy or Not Healthy. You ready?
I'm ready.
Healthy or not healthy? Tattoos.
Oh, healthy.
They got to be healthy. Healthy or not healthy? Chipotle.
Healthy.
Ish?
Ish. Yeah, depends on what you get. Depends on what you get.
What do you think about Chipotle?
I think healthy.
I think healthy. If you order the right thing, right?
Right, if you order the right stuff.
Okay, Healthy or not healthy? The University of North Florida doctorate program.
Oh, super healthy.
Okay.
Yeah.
Healthy or not healthy? The city of Gainesville.
Healthy.
Unless it's game day. after games at 2 in the morning because I've seen a lot of people eat Chipotle and Hungry Howie's at 2 in the morning.
That's true. I do miss Hungry Howie's.
It's so gross. Sorry, Hungry Howie's. All right, that's it. You got any healthier not healthies you want to throw out?
No, I think no.
I never give people time to think of one on the spot. But if you think of any as we're recording, I'd just like those random questions. So, Megan, what's your role again with UF Health and then specifically Night for Heroes?
Sure. I'm the Assistant Director of Development and Events, so I lead all fundraising events for the hospital and the College of Medicine of Jacksonville for UF.
Is this Jacksonville specifically, or you're dipping into Gainesville also?
Jacksonville specifically.
Okay, so all events and fundraising that runs through UF Health, you're tied to.
Me.
Ooh, I got a little bubble guts there. That sounds like a lot of work.
It is. We have a big team that does other parts for fundraising too, but events, that's me. That's all me.
And this is the first time you two have officially sat down and chatted, other than maybe one time in passing.
Correct.
Yes.
I like acknowledging that because if you didn't notice the first half, there was only Edwin sitting here. Now there's 2 of us. This is a fun little curveball. So Edwin is the physical therapist for this year's honoree. We're going to do our best not to say his name specifically. Just to recap, he walked into an airplane propeller. Again, he's fortunate to have an arm. What happens in an instance like that? This is just my experience from the fire department. I don't know if he was flown out, right? Sometimes you have the helicopter fly in, pick him up. Does anyone know that?
So actually, we were talking about this today. So I was actually having this discussion with him today about like logistics. He was just talking about how everything just flowed, the timing of everything. He says the helicopter was there in 12 minutes. He says by the time the police officers that showed up called it in because they realized that he was going to have to get helicoptered out, they said it'll be there in 12 minutes, and by the time they loaded him into the ambulance and drove him to the place the helicopter was already landing. So 12 minutes, the helicopter was there, flew him back to the hospital.
So right off the bat, you have police, fire rescue, and you got a fire truck, which mostly are paramedics now, an ambulance. I'm guessing they probably gave him a tourniquet. They're starting IVs, doing all this. This is just right off the bat. Then you drive helicopter. You load someone in a helicopter. You have trauma-certified nurses, a pilot on a helicopter. They flew him to the downtown Trauma 1 Center with UF Health, right?
Yes.
There's no reason to go to Gainesville, but that's just happens to be where I worked in the fire department. Then you unload from the helicopter. Then you're going directly in a team of how many people when you walk in the door in the trauma center are dealing with him.
Right.
I almost said his name there, but I didn't.
Yeah. Well, he just said, I mean, he stayed awake the whole time. He says he never lost consciousness. He says he was awake the whole time until that.
He must have done jujitsu. He sounds tough.
Yeah, pretty tough dude. But yeah, he says he was awake until they put him under for surgery. He just remembers just a team of people around him.
At least 7.
Yeah.
In the room, I'm guessing. I don't know if you've heard the story, and I don't. I hope I have the honor of meeting him. And so physicians that are in the trauma center, nurses, probably some CNAs in there helping, like just a ton of, it's chaos, right? They probably sedate him, intubate him, put in a tube to help him breathe, and then he's going directly into surgery.
Yes.
And then you got Lord knows how many hours, because this is a crazy, crazy injury.
Right.
That happens. Again, I don't know how long he was in the hospital for. Eventually he gets discharged, and then he goes into outpatient care, physical therapy, occupational therapy. I'm guessing there's at least 30 people minimum that were tied to saving his life and his arm, which is
more.
How. I mean, again, what do you think, Megan?
There's definitely more than 47, but this year's honorees count is 47.
That is a great transition. What I was getting to. So Night for Heroes, while it is honoring him, it's honoring the heroes who saved his life, and that's one of, I'm guessing, a couple hundred incidents per year of UF Health directly saving lives, JFRD, JSO in our community saving lives. I think sometimes people forget the good stories, right?
Right.
So 47 honorees for the Night for Heroes.
Yes.
When's the event? I know the answer to this. Let's start plugging this event. How do you get involved? This is your bread and butter right here.
Yeah, so the event is going to be on Saturday, February 3rd, 2024 at the Hyatt Regency in downtown. So the whole concept about Night for Heroes is we highlight a patient story and then we honor the healthcare heroes that were a part of that person's journey at UF Health Jacksonville.
Again, 47 people. Is that typical? Is it normally around 20 to 40 people? I mean, that sounds like a lot, but that's how many
that's how much it typically is every year. It's around 40 to 50. So there is a process of how we get the patient honoree for the year. We reach out to the whole leadership team, chairs, department chairs, chiefs of the hospital, and we get nominations from all over the hospital. We take the top, the most impactful that we think would be a great story to highlight for a Night for Heroes, and we present that to our Heroes Committee. So we have a group of 30 people who help me plan this event, and we go through the top 3 to 5 patient honoree stories that we can honor. Then we have a physician that comes in, and a subjective physician that
Not tied to this specific
Correct,
incident. Okay.
correct. And that person will present on all of the patient honorees that are up for that selection for the next year. And then the committee will put it up to a vote. So with that patient honoree, whoever we choose, that is how we select our patient staff honorees. And so for you to be selected, you would have had to work with that patient honoree for at least 3 days with his care.
I think, Ed, when you mentioned this too, you weren't sure the criteria. So you have to have been involved with this patient directly for at least 3 days of care.
At least 3 days. You have to be in good standing with the hospital, so no disciplinary action.
Oh, count me out.
So, there's a specific process to be selected.
You'd mentioned this is the Heroes Committee. This is who's, again, voting on patients, deciding, I'm guessing, planning the event, helping with fundraising. Are those all UF Health employees? Are those advocates throughout the community? Who's on this committee?
They are advocates throughout the community. So can I share a little bit of history about
Yeah, of course.
Okay, so we are going to the 17th year, and it first started off as a fundraising gala that was started by a group of physician wives, trauma wives, that wanted to fundraise for the trauma department because we are the only level 1 trauma center in our region. So that's what they wanted to fundraise. Over the years, we've expanded from just trauma to trauma and critical care. And then most recently last year, we opened up to cardiology, and that was based off of the patient honoree that we selected last year who ran the Gate River
I saw
Run.
that. I looked at,
Yes.
so the website too, we'll mention that, and then please continue on that story, but you can go on the website. You'd sent, it's ufhealth.org/heroes.
UF Health Jacks.
ufhealthjacks.org/heroes. And it can show previous winners. And I was reading the stories again, the gentleman from the Gate River Run. There's just some pretty special stories on there. Sorry, so keep going about why it started, what you've seen evolve, and what you're excited for this year.
Yeah, and with new leadership in our hospital, we have wanted to expand this event. We just didn't know when we would do it, and this year we are featuring ortho and our rehab department because they had a huge
I'm fist bumping Edwin right now.
impact
'Cause
on this patient honoree. So we're really excited to expand to support the rest of the hospital. So it's really exciting.
And again, another plug for Edwin here. I'm familiar with healthcare. I've worked in it for a long time. I don't play in that world anymore, but I miss it sometimes. It's just another great example. There are so many people involved with care in a patient like this and other patients. And I think sometimes what gets overlooked is that once you leave the hospital, right, that outpatient care that makes long-term differences, right? You patch them up, you fix them up, they leave the doors, but that they're continuing care with UF Health. And again, you and the 3 other people you mentioned, it's a big deal. I think it is. So thank you.
Yeah,
And also,
appreciate it.
he who will not be named, I'm sure he's appreciative. Too. I pulled this from the website, and again, you can chime in too. So A Night for Heroes is an annual black tie fundraiser celebrating UF Health's Jacksonville staff and first responders who are true heroes, raising funds to provide state-of-the-art equipment to better serve the community, raising awareness in our community of the value of the Level 1 Trauma Center, and providing a joyous occasion to advocate for all the great work done daily at UF Health Jacksonville. Is that accurate?
Yes.
Okay. Thank you, Internet, for letting me pull that up. How long have you been tied to this specific event?
So I started with UF Health last year, actually in October.
Okay.
As Big Brothers, Big Sisters
Yeah.
for the last 4.5 years. However, I started my career in fundraising at UF Health. I was an intern for the development department, which is where I work now. And I always knew I wanted to be in healthcare philanthropy. I think it's so impactful. And so I've been doing the Unite for Heroes back when I was an intern, as an assistant for the hospital, and then coming back here. So fully mine for the last year.
Full time. So this is your second time involved with Night for Heroes.
I would say, and then I also volunteered because I loved it so much back then. So this is probably I'm going into my fourth A Night for Heroes.
What are you most excited for this year? Like, what do you look forward to at the event?
So we do a live appeal every event, and it's usually for a piece of equipment, a really state-of-the-art piece of equipment. Last year we did the MARS piece of equipment. It stands for Molecular Absorbent Recirculating System. I've literally woken up saying that before. And it is...
I thought you said like the planet?
No, that's what it stands for, but we are the only hospital in our region with that piece of equipment. It's dialysis for the liver, so it can help with acute things like helping your liver function on its own. If there's like...
It's a very high-end dialysis machine?
Yes, exactly.
Okay,
So like
I'm going to
if you
research that
overdose on
tonight.
Tylenol, it's something that can help with that. It can be on peds patients. It can work on adults. So that's something that we have raise funds for, and we haven't picked the item yet this year, but it will be versatile. It will probably support our trauma center, but also other departments as well. So that is a huge piece of the night, and we raise typically around $70,000 to $100,000 in just like 30 minutes.
Just
And
for
I think
that.
that's a testament to our community and the impact that piece of equipment will do for us.
So you obviously that short segment raising money for some state-of-the-art equipment that will help, again, future patients.
Mm-hmm.
And when I'm asking you the same question, what are you most excited for? Is it wearing like a full tuxedo and dancing on the dance floor?
My wife is pretty excited. She was pretty pumped when she found out that I was an honoree because she likes to dress up. So yeah, I'm excited for the night. It'll be fun hanging out with the honoree.
Him.
The him.
We've done good so far.
Yeah, I almost said it.
Oh, man.
I haven't said it.
Yeah, and hanging out with him and hanging out with the other people that are going to be there. I think it'll be a lot of fun.
Is it open to the public? How do people find tickets if they want to go?
It is open to the public, and I do want to throw out that the theme is an Old Florida take on a black tie event, so it's an Old Florida theme. So black tie optional.
Mm-hmm.
So you'll see a lot of orange, blue, greens,
Oh.
ish.
Okay.
But still,
When you said Old Florida, I was thinking like cut-off jean shorts,
No,
the
maybe
plaid.
You're ready to go.
Plaid shirt and
let's go.
It's
and a
still
gator
valid.
tattoo on the arm right here.
Well, actually, that would kind of be cool.
Oh, man.
But you can purchase tickets. You can do a table sponsorship. You can make a donation on ufhealthjacks.org/heroes. All the links are there.
Say that website one more time.
ufhealthjacks.org/heroes.
Okay. We'll say that a couple more times too. So you can donate remotely, you can go to the events. What about people that want to get involved outside of just going to that event, right? You talk about the committee members, someone like yourself that was involved and clearly fell in love with it.
Yeah, we are always looking for volunteers to help out with the event and other events that we host throughout the year as well. We are interested in growing our committee for A Night for Heroes. As I mentioned, it's expanding, and new ideas would be helpful from new people.
Fresh perspective, yeah. Yeah. We've done it like this the same way for years. I know that. We want some fresh eyes and do it different. Yeah. Is there live music?
There is live music.
Who's the band?
We're having Chrome.
Oh, I know Chrome.
Yeah.
Okay,
and
sorry.
actually, the lead singer works for our hospital. So it's kind of cool.
That is pretty cool.
That's cool.
Are you a dancer? That was for Edwin, by the way. I like to see how he moves in a scene like, no, looking at his face.
Maybe after a couple cocktails, maybe.
Okay. Yeah, I think it's incredible. I mean, again, so for the ceremony itself, are they bringing the heroes up on stage and acknowledging them individually? What, is he going to get a trophy? Because I'll get him a trophy if you guys don't get him a trophy.
Well, he did. So that's actually interesting because we wanted to incorporate a little bit more on the recognition side for our staff honorees. Over the years, it's dwindled away, and we want to kind of bring it back. The stage takes a lot of time, I will say that, but we'll have Kent Justice as our MC, and he will read off all of the staff honoree names. Hopefully you took your headshot because
I
your
did.
picture will be up on the screen.
I did. I updated my headshot. Yes.
Perfect. That's great. And we will have some volunteers that are dedicated to our staff honorees, making sure, kind of like a concierge, to make sure that you're having a great time as well. But what we are trying to do on our UF Health Jack social media is highlight all of our staff honorees that took headshots, of course, and provided information, so that we can give you some more, publicity outside of just the event, but also out in the community as well.
Well, again, we'll send you all this information, this video. If you want to use it, you can. It's great, but I appreciate you joining us. I have to ask, this is related to physical therapy. How long does it take to recover from a high ankle sprain?
So I mean, it's really, that's a
Worst case scenario, how long does it take?
I mean, worst case scenario, it can take months. Best case scenario, if it's a grade 1, if it's not super bad, they'll probably, wrap them up and get them back on the field, kind of thing. So
I don't even know what you're referring to. I was just curious about high ankle sprains.
I'm
kidding. I'm kidding. We talked about that earlier. Couple minutes left. Anything else UF Health has coming up that you're excited about? Any things that are happening cool in rehab that you're like, man, this is pretty sweet they're working on right now?
Nothing on the top of my head that we're really working on. We're always trying to get the latest and greatest stuff, at our facility. We have things in our facilities that a lot of places don't have. We have an Alter G, which is something that the JAGs and high level other clinics have. That's essentially like a body weight supported treadmill. So you essentially kind of get into it. You wear these special pair of shorts. You get into it. It essentially lifts you up, and you can take up to 80% of your body weight. So you can get, if maybe, let's say the doctor gives you 50% weight bearing status, you can get into it.
It takes the weight off.
Takes the weight off of you.
That's really cool.
Yeah. Developed by NASA, interestingly enough. So we got one of those. We do blood flow restriction therapy, which is kind of more new. I mean, it's been around for a long time, but
you see that happening in the home, blood flow restriction? I see these home gadgets and devices.
Yeah, so those ones are kind of sketchy because
Thank you.
Yeah, because it's essentially like the way they have them set up at home. It's almost like a tourniquet. So you don't really know what you're doing. The ones that we actually have actually monitor the pressures. So you can, for example, you can occlude 80%. It'll monitor that. It'll essentially 100% occlude you, and it'll back down to 80, and it'll measure that. So as you're moving, it'll keep you at 80% occlusion while you're moving. So it's much more sophisticated. It's really good. It's a great way to kind of rehab people that maybe can't move as much as they you want them to, but you want to fatigue the muscle out. It's a great way to work.
I love again technology advancements, especially in the physical fitness world. All these cool stuff. I am curious. Ice baths.
Oh yes,
that has exploded in popularity.
I actually have my own cold plunge at home.
Which brand? Is it like a bin?
Polar Monkey. Yeah.
Okay.
I have Polar Monkey.
We might have to talk
afterwards. It has its own chiller. Right, it's fantastic. Yeah.
I've got a sauna, and now I'm shopping ice baths.
Yeah, that's the next thing I want. I want a sauna next.
Yeah, at least a couple times a week. Megan, anything, stuff you're proud of that you see coming down the pipeline at UF Health downtown, the campus they're building? I don't know if you're doing any fundraising for that. Oh, just kidding. What else?
Well, I just want to say thank you for having us.
Of course.
And to all the listeners, even if you aren't able to join the event, you can still make a donation. And then if you like shopping, we have a silent auction too. So that information will be out on our social media platforms and also on our website.
Okay, so if you're not going to the event, still want to be involved, feel free to donate. We'd love that. Silent auctions are always fun if you can't be at the event. Okay, how much time we got left? 4 minutes. What should we talk about for 4 minutes, guys?
Anything you want to talk about?
Can you talk about prevention? So we've kind of honed it. Sorry, I'm talking.
Go ahead, come on over here and talk in here.
Really on the shoulders.
Mm-hmm.
Could you just talk about for your average consumer, some prevention tactics, whether it's stretching or you guys mentioned ice baths and the sauna?
So, I mean,
I'm gonna restate the question in case it wasn't on the mic. So, opportunities for injury prevention.
Right.
We talked about shoulder a lot. Knees are big ones.
So let's just say for what I do, like Brazilian Jiu-Jitsu. So the best thing you can do is try to strengthen the muscles as much as you possibly can. You want to stretch. You want to take the time off when you're injured. Like I said before, a lot of people don't stop training. So you got to listen to your body. Ice baths are great, especially when you get older.
Guilty.
After I train, I get into the ice bath after when I get home. It really does help with the inflammation and things. Essentially, the best thing that you can do for just long-term, keeping yourself healthy and not injuring yourself is keep moving, exercising, doing things, stay active, keep moving. Exercise is medicine. It really is. So the best thing you can do for yourself is not get sedentary. Don't let don't get weak. Don't get don't get to the point where your joints and muscles are so tight. And then you do something. You reach behind to go get something, your purse in the back of the car, and then you tear a rotator cuff, or you tear your labrum. Like, that stuff happens all the time. So trying to stay active, trying to stay, limber, general stretching, but, exercise. Like the literature, there's a lot of argument, like what's the best, protocol, or what's the best treatment for this or that. But the common denominator is always exercise. Like, moving, doing some form of exercise is so important. And I think, like, long term, it really will help you prevent you from having some serious injury.
That's the two things I constantly talk about. Is one, just move, right?
Yeah.
If you can't do regular push-ups or anything, like, just walk.
Right.
Anything is better than nothing, and then your body will tell you,
so
I'm capable of this.
Yeah.
The other, I don't know if have you ever heard the line is, we don't stop playing because we get old. We get old because we stop playing.
Right.
Have you ever heard that line? I love that line.
Yeah,
It's
yeah.
The day you stop moving or playing or doing these things,
right,
you're gonna.
I think it's important when people get older. I think there's this idea that they feel like, I'm older, I'm 40, I'm 50, I need to slow down. But then you slow down, but then you just change. You know what I mean? Now you just kind of just changed your level of activity and you change your level of function. You should try your hardest to stay, exercising and doing things at the highest level that you can. I would say don't, of course, listen to your body. Don't be irresponsible and hurt yourself. But you also, like, if you're doing something you love, keep doing it. Like, don't stop unless there's something like a reason to keep you from doing it. Like, don't let your age tell you, like, I should probably slow down. If you feel like you're capable of doing it and you're still doing it and you love it, keep doing it. Like I said, exercise is medicine.
That really is possibly the greatest exit sentence right there and advice I could think of. So Megan, representing what's the department and role you're in? Fundraising, but Night for Heroes specifically. Mm-hmm. What was it? Assistant Director of Development. Mm-hmm. You help find those cool new tools, right?
Yes.
Thank you for hopping on the second half. Again, Night for Heroes coming up February 3rd. Edwin Rivera with UF Health Rehab, also one of the honoree, getting appreciated for the honoree specifically, especially in that post-acute world. Thank you for joining me. That was great. I hope you had a good time.
It was fun.
Yeah, that's what the health just happened.